everybody? It's your boy Marcus Nomer from Gentleman Style Podcast, your host of the number one podcast coming to you live in America. And today we have an incredible guest he's a nurse practitioner, adjunct professor of pharmacology, and published author of the Nurse Practitioner's first year Guidebook. This guidebook is dedicated to educating medical professionals seeking to find out what their first several years in the industry is going to be like. And he wrote the book, y'all. He has also worked at the Mayo Clinic as part of their cardiac transplant team and has branched out on and to own his own practice for the uninsured or underinsured citizens like yourself. And so this gentleman is impactful. He is changing lives, and he is an absolute mover and shaker that we have to get behind. And he is changing the way health insurance does business. But most importantly, he is here to answer our questions, my questions, your questions on COVID-19. The infamous COVID-19 that has just affected us throughout the course of 2020 and probably the foreseeable future. But he's here to lift the veil on some of that. So today we are introducing Mr. Shane Grindle. Welcome. Please like, share, and subscribe. Hey, Mr. Shane, how you doing? How's it going?
Hey, man, it's going somewhere. I don't know, but it's going, right?
It is.
Busy, man. It's busy.
It is. That's a good thing. Yeah. That's a real good thing.
It's a good thing. It is a good thing. Hey, it's fine. Idle hands, right?
Yes, exactly.
Yeah, sure.
Exactly. Mr. Rashad, Mr. Shane, sorry. My friend Rashad got me messed up. You messed me up, Rashad. Mr. Shane.
It's fine, yes.
You're awesome at what you do, but your practice is unique and different from any other practice that I've seen. Tell us, what is it that sets your practice apart from everybody else?
No, that's a good question. It's a new take on healthcare, right? It's called direct primary care, right? So instead of you paying an insurance company a large monthly fee, you have deductibles and copays and prior authorizations, red tapes, maximum out of pocket. I try to cut that out and say, hey, just kind of give a monthly membership fee, which starts at $69 for me. It's $69. That's really it. That's like a Gold's gym membership, I like to think, but the other perk there is that you get to have full access to me. It's like the Netflix of like healthcare, really. Like you pay one monthly fee, you have limited access, you get part of our we get labs for cheap instead of paying cash prices to LabCorp, Quest, whoever. You pay me $60 and that covers your whole annual labs, which I've saved many people $600-700 just on labs. So that pays for it by itself. That's just kind of my thing. And I try to keep you out of the ER. That's expensive. Like who wants to pay $1,000 to go to the ER? Like how is that feasible or reasonable? Sorry, I'll put those two together. It's just hard. And healthcare is already expensive. And even if you go to the ER, they don't know you. They don't know you like I know you, right? Things get lost, or even at the urgent care, things get lost. So I have, there's no waiting for me, right? You get 3 or 4 weeks out there, but here it's like, I can get you in within the first couple of days. I mean, that's really it.
And that's significant, right? That's unheard of in the medical profession, because you actually can take care of people on the spot without the high cost of medical insurance. And so tell us about this sign here. What does the symbolism mean?
This is me. I mean, Integrative MedGroup is, for me, is where you really, really integrate many things, right? The patient, their preferences. Some people may not want to be on medications right there. I give them time to adjust their diet, their weight loss. We can try different things before we do medication. So that's one part of the integrative wellness. And then we look at, the whole patient, right? And then that's kind of what we do as nurses and nurse practitioners is we offer that holistic model, right? It's, but we still practice good healthcare. We still do our medicine. We still do those types of things, but we incorporate many different things. It's just, we integrate many things into that. So that's the way that I look at it. And, and just to have that trusting relationship with my patients is very important.
Absolutely. So there you have it, y'all. Right then and there, the man, the myth, the legend. You can see him. He'll take care of you. He'll see you. I remember my first visit to a doctor. I mean, the man came in, turned his back, and asked me some questions and diagnosed me, filled my prescription, and never even looked me in my eye. With Mr. Shane and his company, he's gonna know you. He's gonna know you inside and outside, and he can also take care of you. Most of the time for on site, at least 75% of the things that we need, the ailments, the ouchies, the pains that we have,
Exactly.
Mr. Shane can take care of you on site with his affordable. Did you hear that? $600 savings value right in your pocket at home with his company. So that's absolutely powerful, brother. I appreciate you. Thank you for giving back in that way.
Yeah, man, that's kind of what I'm here for, is to help out and do my part. You know, I've always done that, at least tried to. You know, I was in the military at the
Thank
Navy.
you for your service.
Yeah, of course. And so I was like, it's time to do something bigger and better, and that's what brought me into healthcare. And so that's kind of why I'm here.
And you are doing it, brother.
Thanks.
So here we are with we've survived, right? It's 2021. We've made it. And there's one thing that has been plaguing us all year is COVID-19, the coronavirus. Tell us, what is the coronavirus and where did it come from?
The coronavirus is one like many other viruses. You've got adenovirus, coronavirus, influenza. It's just a different type. It's the word corona is kind of comes from about what its shape looks like, kind of like a crown. Really is a coronavirus, and it kind of impacts the respiratory system. That's why you see people that are ventilated on those vents, is that they've just kind of succumbed to that respiratory virus. That's what causes it. And it causes inflammation to the lungs and those types of things as well. And we suspect it came from an open market in Wuhan, China. It jumped species. We think it was bats. We don't know exactly. We heard some other animals. We don't know. But the thing about viruses is that they're so keen to mutate and change. And so that's what causes them to jump from species to species. And it's not unheard of, right?
Right.
It's really not unheard of for them to mutate and change and jump species. It's just that it's more contagious now. It's a more contagious form. And now we have another mutation that started off in the UK, right? That mutated, and now it's even more contagious. Good news is it's not more deadly, thankfully. It's just more.
Thank God.
Listen, I'm like, I don't know how much more of this I can take. I think I'm gonna take a nap and then get back to COVID, but it's good. It's good. It's just more contagious, not more deadly. So that's a very good thing. So
absolutely. Millions and millions of lives have been impacted by this. Families, loved ones, friends, family members, industries, business, small businesses, large businesses, all have been affected by this one virus. What makes the coronavirus so dangerous to human beings?
Well, it's like I said before, is that it's so contagious. And not just that, is that you're asymptomatic for when you first get, inoculated by the virus. Like, you don't know you have it until it gets to a high viral load to where you start to have symptoms. And these can be non-specific, right? Fatigue, right? You don't know. Like, I'm always tired. I may have coronavirus and not even know it. But no. I got vaccinated, but
awesome.
Yeah. I'm doing fine. I'm not a zombie yet, so I'm all right.
Thank goodness.
Yeah.
We need you here.
Man, yeah. I want to be here. So, no, it's just, especially when it attacks the respiratory system, the lungs, and the inflammation, especially in people. We don't know why it causes this. It's called cytokine storm. It's where your body just overreacts, puts too many inflammatory markers, and attacks the lungs. And so, if we can't breathe, we don't live. So that's one of the things there, and that's what gets you on a ventilator usually. And so it's very important. And people that are already sick, diabetics, asthmatics, COPDers, you guys should be the most ones that are like, hey, I need to wear the mask. I need to stay in the house. It's just so important. That's why it's deadly, is that it attacks the lungs. Exactly. And you don't know it until you know it, right?
It's too late.
Yeah, it's too late then, and you've already infected who knows at how many. The way that we look at infection is a number called R naught. And R naught, the higher it is, the more effective that it is. Like instead of like, let's just take flu for example, is like, let's say it has an R naught of 2. It means for every one person you come into contact with, you may infect 2 more, right? COVID is different. Yeah.
Okay.
R naught is, I think it's 4, I do believe. So every person that gets infected, you now are doubling it. Now you have 4 people that you're now infected. Now you've got it. Those 4 more, and then it's just an exponential growth. That's why it's so important to social distance. Wear your mask. Like, we know how to fix COVID. It's just wear a mask. It's not fun, but they're important. Like I don't know. Like I have many of these just in case, right?
Everywhere.
I mean, if you, heck, I'll send you some. Like it'll save a life. Like one life is important. One life is important.
Absolutely. So you touched on it, and you touched on something very important. We now know there are some preventions, man. We've lived through this for almost a year. What are some of the symptoms of how someone can tell they may potentially have the COVID-19 virus? What are some symptoms to be aware of?
Very good question. Honestly, Johns Hopkins showed us the earliest signs is just fatigue, right? You're tired, you don't feel well. And then you may progress to, I can't taste or I can't smell, right? And so that is one. And then of course, and not everyone will have all of these, but what it is that it's so non-specific, right? It could be anything. I didn't sleep well last night. I'm very tired. So with that being said, it's fever, it's chills, it's like breathing issues. Like I can't catch my breath, right? I can't catch my breath, or like I'm sitting here and I'm winded. Like that's not normal, right? And I'm sitting down. That's when you should probably go to the ER. Is like when you're not breathing well, just sitting down. That's a bad sign usually. So we need to look at that further. But most cases tend to be kind of mild. With issues breathing, you may have like a fatigue, fever, those types of things. Just not feeling well. You just don't feel yourself, or some people may not even have any things at all, like Typhoid Mary. Remember Typhoid Mary back in the day? She was just a carrier. She never had anything, just passed it on and on and on and on. Right. And I think she's the most dangerous, is that we don't know that she's, infectable because she's not showing anything. Right. So you may not have anything. So that's why you should stay at home, is that you may have COVID and not even know it, honestly.
That's true. This is Mr. Shane Grindle, y'all. He is spilling all the tea on the COVID-19 virus that we have overcome and survived. If you are tuning in today, you have survived a year of COVID-19. And Mr. Shane Grindle and his company are lifting the veil and answering our questions on COVID-19. We are going to go to a quick commercial break, and we will be right back. Stay tuned.
Are you a local business looking to offer your customers easy access to cash without having to travel miles? We're here to help. At Norman Legacy Investments, we provide free ATMs with free installation that provide a suitable investment for your business. Even better, we offer you some profit sharing and handle everything from start to finish. Just reach out to us today to schedule a free consultation.
Hey guys, this is Marcus Nomer from Gentleman Style Podcast, your host of the #1 podcast, coming to you live. And we are on all major platforms: iHeartRadio, Spotify, iTunes, YouTube, and Facebook. And today we have the incredible, the amazing, the super fragilistic espialidocious.
I love it. Thanks.
I love it. Shane Grindle and his company, his brand, Integrative MedGroup. And they are lifting back the veil and answering our questions about COVID-19 and the deadly virus that we have overcome. We have a question from the audience, so we're going to bring it up on the big screen. How close are we to getting this virus contained?
Yikes, that is a good question.
Great question, Daniel.
That is a great question. We're not putting out as many vaccines as we would like to do. We so far only vaccinated roughly 2 million people, and that's not enough. So I wouldn't say close. I'd say the end is near for the COVID-19. Maybe not in the next 60, 90 days, but it is coming. I mean, we are close, and it really depends on the American people. Like, can we wear our mask? Can we social distance? And sometimes we can, and sometimes we can't. So really, I would kind of look within and see, hey, let's do our part. The more we do our part, the better off we'll be. So
great question.
Please, thank you. Yeah.
Absolutely. We have another from Miss Bonnie. Miss Bonnie asks, can taking vitamin supplements such as vitamin D3, zinc, vitamin C, potassium be helpful in building up my immune system?
Studies have shown, everything we have now is sort of anecdotal because it's so new, right? But studies have shown zinc, vitamin C, and vitamin D has been very helpful. Not sure about potassium, but I have heard of an herbal called echinacea has been very helpful too. So those are some very things you can do to give yourself that support, but always better to stay home, isolate the best you can. I know it's hard, but yeah, that's the best way. But there is some science behind that.
Absolutely. Great question, Ms. Bonnie. Thank you for that. And thank you, Mr. Shane. Mr. Shane, now you expressed earlier the ways to protect ourselves, face masks, gloves. Are they really truly effective in helping us minimize the spread of this COVID-19 virus?
Absolutely.
And so that we're debunking that myth. I want to debunk that. I want you to debunk that myth, right?
Absolutely. So
is there a difference between masks? Like
there is.
Okay.
There is a difference between masks. There are different degrees at which it will protect you from the virus. Really, your everyday cloth cotton mask are okay. I don't think you need to have an N95 mask, which is the next degree up, to where that's where your healthcare workers need to have that. So it's not going to give you as much help because it helps when it's aerosolized, right? Coughing, we intubate. Everyone's got to have on an N95 mask and all that good stuff. But for you, regular masks are fine. Gloves are good. But the thing about gloves is make sure you take them off when you touch another surface. Just don't wear that same pair of gloves all day long, please. That's not gonna do nothing for you. Just take them off and change them. That'll be. But wear them nonetheless. Wear the mask. And so not only does it protect you from incoming things, but protects others from outgoing things. So we now have two ways of kind of protecting ourselves and others is with that mask. So that's why it's important, is that there's a lot of benefit there. And it's a aerosolized virus in the breath, in the sputum. And so that's yes. Wash the hands frequently, often. You should be doing that anyway, but you should be doing it anyway, but we should especially do it now, right? I mean, we now have a real reason why. Like, hey, this is definitely.
Absolutely. I've evolved. I got now a miniature size hand sanitizer, so I'm constantly sanitizing my hands, and so I have heard that's even better. That's more preferable than the gloves because it's like you said, every time you touch a surface, you have to change those gloves.
Yeah.
But hand sanitizer,
throw them away and put them in the trash can, like you're saying. It's another fomite, right? That's the fancy word we call for things that attract a virus or bacteria. Is called a fomite. The gloves are another one. Just toss them away, and once you're done with your shopping trip, toss them, or done touching one thing, toss them. That's just kind of what it's good. Wear the mask, social isolate, right?
Absolutely. So here's a key thing that I wanted to debunk. Are people that are asymptomatic less contagious, and are people who are pre-symptomatic less contagious?
Absolutely not. No, they are still equally contagious as they were. That's why it's important to socially isolate and stay at home, because even though you're feeling well, you don't have anything, you're still contagious. That's the key. That's why it's so imperative that we stay in the house unless we need to go out. Listen, I understand you have to go get your foods and your medicines, go for it. But be kind of judicious, is that you still can give away the coronavirus even if you don't have anything going on. Like I use Typhoid Mary. That I think she's a very good, picture, is that she's very contagious even though she didn't have any symptoms ever of typhoid fever. That's just kind of how it is with coronavirus.
True. So there's a lot of stuff lingering out there about vaccines. There's a microchip in the vaccine. The vaccine is actually this other thing. Yeah, is this other thing. How do vaccines work?
Well, they work by a couple of things, right? You have a live vaccine, or we have live attenuated, right? They're a weakened version, or now the brand new version called messenger RNA. That's the versions that we're using now. These are messenger RNA vaccines we're using. This is a brand new way of looking at it. So that's what we're using now for the first time in history, and they're seeming to be more safe because we're not using a true viral particle, right? We're using a messenger RNA which codes for an antigen, and then it actually uses this to code that antigen in, instead of having the dead or the live either bacteria or the virus in there. So that's the messenger RNA. It codes for the protein. So it's not the actual protein, it's a coding.
So that is to trigger our immune system to respond as if it's the actual virus.
Exactly. Without having the actual virus in there. So you're not even getting any of the coronavirus. You're getting the messenger RNA to code for it. So think of it as like remember back in the day, the coder ring things. That's kind of how it is. Or yeah.
That makes sense. And that's huge because that's all it is. It's our own natural bodies. Like you said, the three different ways. It's a weakened form of the virus. Now the new form, messenger RNA, which is the genetic coding to trigger that response. And that's all they are. They're just triggering the response of your body.
Getting infected with COVID, right? It's not it. It's a very safe, because we're not introducing that actual COVID particle, right? It's just kind of one of those things. It's just that it just codes for a protein, right?
Perfect. Yeah. Hey Betty, how's it doing? How's it going?
Well,
if you are just subscribing to the channel, this is Mr. Shane Grindle. He's a specialist, and has his own practice, and he is lifting the veil on all our COVID-19 virus questions. And so thank you for tuning in. Please like, share, and subscribe. Thank you, Betty, for tuning in. We love you. We appreciate you. Definitely. We have another question from our audience. Miss Bonnie is ready. Do you recommend using isopropyl alcohol to sanitize in addition to traditional sanitizers? Alcohol is cheaper and available in larger sizes for people with limited income. Ooh.
I don't see a problem with that, honestly. As long as it's at least 70% or greater, go for it. Absolutely. And if you can't afford it, and that's a great way. And it works the same way. So definitely, I would say go for it. Just make sure it's 70% or better.
70% better. Don't get that cheap stuff.
Yeah, cheap. Yeah, don't get the cheap. At least get 80 to 90%, and then yeah.
Unless at worst push come to shove, get some drinking alcohol.
Exactly. Get some tequila or some moonshine. All right, get some moonshine on hand. Right.
Love it. Miss Daniel Clark tunes in, and she's helping us after going through the quarantine process of COVID-19. Bless you. I think she's saying that she had it at one point.
Yeah, poor thing.
Wow. And she survived it. How long do the antibodies remain in your immune system?
That's a good question. We suspect now it's 90 days. We suspect you have 90 days at least. It could be more, but right now it's 90 days. So you should be protected for 90 days. So I would still get the vaccine even if you've been infected. Maybe it's not as pressing for you. Yes, get the vaccine even if you've already got infected, because this is not lifetime immunity, right? Because just because you've had it once, you can get it probably again, we think, because it's just like the influenza vaccine. I mean, you need to get that every year, right? And that's what we may be thinking with the COVID vaccine, is we may need to get it every year. Not sure yet, but we're still working on the research.
So I'm gonna ask the question. Great question, Danielle. That is absolutely a great question. But I'm gonna piggyback off of her question. If you have the virus, if you had those symptoms that you discussed earlier on the episode, you're tired, you're sleepy, you're exhausted. Should you, if you contract the virus, will the vaccine cure it?
The vaccine will not cure it. The vaccine is not a curative thing. Remember, it only transcribes the virus. So with that being said, you're already infected with the virus itself. So once you clear the virus, then go for it, right? Which should be, within that 14-day incubation period. So Perfect. After that one, you should definitely do that for sure. So it's not curative.
Absolutely. So it's not curative. So don't think y'all is like, okay, now there's a vaccine out, I can stop wearing my mask. And that's why I wanted him to touch on that. A lot of people think, okay, a vaccine is out, we're good to go. I don't need to wear gloves. I don't need to sanitize. No, you still need to protect yourself.
Facts. Yeah, facts. Yeah, this isn't the magic bullet. It's a way, like you and I were talking about earlier, is to flatten the curve, right? And instead of us having this massive surge of persons with COVID infections, the actual vaccine will help. Instead of having a big curve where we have to meet that demand, granted, now we're having small little ones to where we're not overwhelming our healthcare system because we have limited resources, right? We have a finite amount of doctors, nurses, nurse practitioners. It's all finite, right? So we need time to recuperate in between each surge. Just give us some help. We just need your help to, not overwhelm everyone at the same time. So that's why we asked you. That's another reason to wear your mask, right? It's to flatten the curve. I'm sure you've heard Dr. Anthony Fauci say that many times, flatten the curve. And that's what he means by flattening the curve. You're just helping out your local healthcare provider, and we appreciate it.
Absolutely. Wear your mask, y'all. Mask up.
Mask up.
I'll
send you mine if you need it.
Yes, I'll send you mine. Shoot, I'll pay for it. I need us to wear a mask. This thing is killing us. So why are people who are diagnosed with the virus quarantined for 14 days? What's the significance behind the 2-week time period?
We think that gives the body adequate time to respond and to get rid of the virus. So after that point in time, we think around the 14-day period, we should be at a point to where you're not as infectious. You may not be 100% free of the virus itself, but you're not as infectious. So the 14-day quarantine kind of helps with that.
Perfect. Ms. Danielle is back. She's ready for round 2. She wants to know, why are there 2 doses of the vaccine? I'm not sure what she means by that.
She wants to know why that there is 2 vaccine doses, like for the Moderna, the Moderna, the one, no, I got the Pfizer. Pfizer is 2 doses. And that's because that first dose is not enough for your body to mount a good, long-lasting defense, right? So now we need to do another round of it. So that way we have longer lasting safety and prevention against the virus. So basically it's an inadequate amount of time for your body because it needs another dose to kind of reinforce that.
And to keep those antigens going. So
antigens going. Exactly.
That makes sense. Great question, Danielle. She about to put me out of a job. Yeah, she was trying to put me out of a job. This is my show, girl. I love it. No, thank you for that question.
I love them.
We're talking about, so you just explained for my audience and me the vaccination process. What are the different types of ways to test for coronavirus? If I think I have it, what are the different types of tests that there is out there?
So the one that you'll see most often is called the NAAT test. So the NAAT test is the one, is the one that takes a little bit more time, but it's more accurate. And then you've got the Yeah, me too. I got mine too. I got the Pfizer. And so far, only thing that I had was some pain and some fatigue. So I took a nap and I was fine. So I'm doing okay. So
Snap right back. Bam.
Snap right on back. I was good. So yeah. No, those are the two. You've got the rapid one, which is a little less accurate, but it gives you fast results. You either know you do or you don't.
What it is? It's an injection or what is it?
No, this is just the test then of themselves is like a nasal pharyngeal swab, right? The one where it kind of chokes you a little bit. That's the NA. I know. I hated it. But it had to be done. So yeah, I can't go to work sick. So yeah, so negative for me so far. But yeah, I know. Yeah, we're good. And I'm vaccinated, so double good. So no, it is a nasal swab. It's pretty easy. It's pretty fast. Both of those are actually pretty fast.
So I had the nasal one. I think the nurse didn't like me because she did both nostrils. Was that necessary, or did she just not like me?
No, she may have not got a good sample on there. I don't know what you did to her, but I don't know. But usually one's good.
So she was messing with me. Got it. I'm gonna go back to CVS and complain. So Miss Shanique Henry is on here. Hey Shanique, could you test positive after receiving both doses of the vaccine?
That is definitely a good question, and we don't actually know just of yet. But just using a little bit of critical thinking, I would say it would be yes, because of you still are having the antigens. Just because you've never had an active infection, you still have the antigens and antibodies against it. So maybe I'm gonna say maybe is a good answer. We don't know exactly yet. Like I said, everything is anecdotal right now, and we're still trying to figure our way through it.
Absolutely,
it's a brand new thing, and we're learning as we go. At least I know I am.
Absolutely.
But I want to say maybe.
Absolutely. And Ms. Daniel is making fun of me. No, one nostril is good. Okay.
Yeah, she's right. One is good.
So I'm going back, y'all, to CVS and complain because that was ridiculous.
She had a vendetta, huh?
She did. Mr. Shane, how do you give back to the community?
For me, I actually volunteer. We did a homeless volunteer thing where I gave some free blood pressure checks and things over there at the local church. We actually did that as well. It was a very good turnout. You'll see on my Facebook page that it was a pretty good turnout. And I think my clinic is my way of giving back. Honestly, is like people are losing their health care, they're losing their benefits. And I'm like, how can we fix this? And I think my model of care is one of the ways to make it more affordable and kind of accessible.
Explain that model of care real quickly. I got some people tuning in for the first time. So y'all, Mr. Shane's model of his company, his medical facility is different from most others.
Right. It's different as though we don't need insurance per se. We'd still recommend that you have catastrophic insurance in case you need to get hospitalized, but it's super affordable. But for your routine everyday care, it's just a monthly membership fee for us to have full and unlimited access without any type of copays, deductibles, maximum out of pocket. Just keep it simple. And that way I don't have to see so many patients. I keep my panel very small, and everything is at least 45 minutes to 1 hour. So I get to really know you and have that one-on-one time with you that I think I need. And that's kind of been pulling back out of healthcare because we're so overworked and overwhelmed, and there's so many patients that are sick. I mean, it's just kind of one of those things where I can give back and to make it affordable. So you're not having to, take out loans to get, pay off your ER bill. That just makes no sense. We spend 20% of our gross domestic product on healthcare. Think about that. 20%. Like that's look at the United Kingdom, look at Canada.
Wow.
Well, they're not even close. They're still in single digits. So what's causing the expense? There's a lot of different things, but I'm hoping to fix that.
You
Sure.
are.
Yeah.
You're completely changing the way the medical practice is. Even though this is a new thing, y'all. So his practice, you can go get seen from beginning to end, whether you have insurance or not.
True.
You just pay a monthly fee for him, and he takes care of you in-house.
It's like
70% of it.
Netflix of healthcare. It's like the Netflix, right? You pay a simple one monthly fee, and then you get access. Yeah.
Absolutely. So Miss Brina tune in. Hey Sabrina, how's it going?
Hi.
She's tuning in, and this is a great question. Do you know when the time comes, can you ask for a certain vaccine or the other? Or do the doctors only have one vaccine in stock? So I guess the Pfizer vaccine or the Moderna
Can you do
vaccine.
the Moderna, the Pfizer, or the AstraZeneca? In the beginning, I'm going to say no. We have what we have, right? It's just a supply and demand. In the beginning, no, but as we start to progress, I think you'll have the option of choosing. But right now, it's so limited that no, not right now.
Absolutely. We got another great question. Thank you, Sabrina, for that question. That's awesome. Miss Michelle, do you believe that you have some level of immunity if your antibody is positive?
I would say yes, because when you have an antibody, that means that sometime you were exposed to COVID-19, right? If you do have some antibodies, right? True. So that exposure gives you that level of immunity for that 90 days as we think right now, but it may be more. We're not exactly sure, but the short answer is yes, it will.
Absolutely. Love it. What's your favorite book that you recommend for most women and men to read?
I mean, I think Rich Dad, Poor Dad is kind of like, everyone should read that book, right? Rich Dad, Poor Dad is like everyone, we're not taught finances in high school or even college. It's taken upon ourselves to learn to manage our money smart, so we're not living paycheck to paycheck, and that's not a fun clinic. I mean, not a fun. Sorry, I looked at the clinic and I was like, not a fun feeling. Sorry.
Thank you, Bonnie. I appreciate it. You threw us off. Where is your clinic located?
It's in Jacksonville, Florida. We're just right at almost at the center of downtown Jacksonville. Yes.
Love that. So Miss Bonnie, if you are looking for his clinic or you know someone that needs his clinic, check him out. He's go back, have the screenshot of the door handle is impressive. Really good artwork on there. Check him out if you know someone. Sir, how can my audience get connected with you? How can my audience give back to you and support you and uplift you?
Definitely. I do indeed have a Facebook page that you can join and follow and see what I'm up to as usual. Definitely. I also have a YouTube channel that I'm starting to kind of create some educational videos to help demystify and educate both the public and other providers, just to kind of give back in that sort of way, for sure. So, and then I have a website for my clinic, integrativemedgroup.com, and that'll give you sort of a overall feel about what we do and how we operate. I think that'll be good. So that's kind of where I'm at with it today. But thank you guys for sure.
Absolutely. And you didn't touch on our book.
Oh,
you didn't touch on the book.
I forgot. Sorry. Yes. No, I actually wrote this book not just for providers like myself as a nurse practitioner, but also for people to get an idea about what a nurse practitioner does and what we go through in our training and our education and what we can and can't do. Because not everyone knows exactly what a nurse practitioner is or does, but this book will give you some insight about where we started, why we were created. And I just think what I'm doing is why we were created is to increase access to clinic care, primary care. And that's why we were, because there's a deficit of MDs and DOs, that's why us and the PA was created, is to make better access to healthcare. And that's what the book does and sort of explains.
I love that
as well. But it is a very good resource for the nurse practitioner's first year. So it's some good information and, some good pearls and some things that will make you successful and some my thoughts. It's just I like it. I wrote it, but I'm
You're partial to it. Absolutely.
Yeah.
But it's a great book, y'all. If anyone needs to get a copy of that book, please check it out on Amazon. It's called The Nurse Practitioner's First Year Guidebook.
Mhm.
And if anyone needs help finding it, please inbox me or reach out to Mr. Shane or on his website, integrativemedgroup.com. That's integrativemedgroup.com. And he's starting a YouTube channel. Mr. Shane, sir, I appreciate you, brother. You are awesome. You are incredible. Miss Michelle, we appreciate you. And I think you might be immune, girl. You might have an immunity. You're walking around here. We might need to, don't let that word get out. They might have to snatch you up, put a body bag over you.
Yeah. I mean, or like I was saying before, is that you may indeed just be an asymptomatic carrier, like Typhoid Mary, right? I use it a lot because that's kind of how it is that I would still isolate, quarantine yourself during that period of time. But you're one of the lucky few that not really affected by COVID-19. So we're still in the preliminary research of it, but I'm sure there's others like you out there for sure.
Absolutely.
One of the lucky.
Yeah. Appreciate you, Michelle. Stay safe. Absolutely. And mask up. Mr. Shane, thank you for your time today, brother. We appreciate you on the Gentleman Style Podcast show. We appreciate everything you are doing. Continue to do and don't give up, because what you're doing is needed.
Thank you.
Absolutely. If you need anything from us, please reconnect. Anything from me, I'm here for you, brother. I appreciate you giving back in this way. This means a lot. And thank you all for tuning in to Gentleman Style Podcast show today with Mr. Shane Grindle for Integrative MedGroup, spilling the tea on all your COVID-19 questions of the year. So like I always say, y'all, stay engaged, take care of your friends, take care of your families, and take care of business. This is Marcus Norman and Mr. Shane Grindle from Integrative MedGroup signing off. Love you guys.